U.S. President Donald Trump says China could have stopped the COVID-19 outbreak quickly and prevented it from spreading across the world. He said the U.S. was carrying out serious investigations and suggested Washington could seek reparations for economic damage done by the virus. His briefing also focused on moves to reopen businesses and schools, an issue that's put the federal government at odds with state governors and ended in mixed messages for the public.
In the United States, governors are making very different decisions on whether to ease the lockdown.
Thank you very much. You're seeing a lot of governors get out and they want to open it up. Many are thinking about their school system. There's not a long way to go in the school system right now for this season, for this year. But I think you'll see a lot of schools open up, even if it's for a very short period of time. I think it would be a good thing.
In Georgia, restaurants, nail salons and even cinemas are already opening up for business, despite 25,000 reported cases of COVID-19 in the southern state.
It's not a decision we take lightly, but we do know that the governor has allowed it here in Georgia, and we're looking to his leadership as an indication of when it's appropriate for us to open.
While in California and Texas, hundreds of people are visiting beaches, very little is open for business in the deprived city of Baltimore, Maryland, which has reported almost 20,000 cases of the virus.
Numbers have not gone down enough for us to feel safe or secure about the future current conditions right now, so I think they need to remain closed for now.
The lockdown can't continue forever, but each state will have to make its own decisions about how and when to end it.
Well, the briefing you saw President Trump giving in that report was his first following a storm of criticism over his remarks about injecting disinfectant to cure coronavirus. I asked our Washington correspondent Stefan Simmons whether the president has managed to shake off that controversy.
Well, I think no, he didn't. He's doing his best to ignore it. He clearly caused it. And as you remember, he tried to pedal back a day after, claiming that he just made sarcastic comments and that it was more or less jokingly what he had said, that people should consider ingesting or injecting disinfectants inside their bodies to clean their lungs or ultraviolet light. Of course, the experts came out to say, well, please don't do this. Even the companies who produce this came out to say, please don't do this because it will kill you. You cannot ingest anything disinfectant, Clorox, Domestos, or Lysol, or whatever the products are. And now what is the president doing? He's ignoring any other and further questions. He said today he will not be held responsible for a upsurge in calls to the poison centers here in the United States over the weekend and the days before, people calling in asking if they should take the president serious and ingest disinfectants. He says he's not responsible for this. And again, as I said, he claims now to have made sarcastic comments only.
Well, moving on to New Zealand, where nearly 500,000 people have gone back to work as the government eases the national lockdown. Some aspects of daily life are getting back to normal. Hospitality businesses, including coffee shops, have reopened for takeaways. Construction and work on major infrastructure projects is also resuming. Prime Minister Jacinda Ardern thanked New Zealanders for their resilience during the shutdown, but she warned that the fight against the virus is not over yet.
It is an ongoing battle. There is not one point in time that this mission ends now. Yes, we have done that in lockdown. The goal now is to keep up that work. So we're now in the next phase of the battle and we are not done. Around 75% of the economy is operating, with key sectors like building and construction, forestry, manufacturing and contactless retail starting back up. Importantly, major infrastructure projects start up again today.
Now let's catch up on some of the other stories making headlines around the world today. The Australian city of Sydney has reopened its famous Bondi Beach to surfers and swimmers. The Golden Sands were closed last month after thousands of people ignored social distancing rules. Residents are now allowed back in the water, but walking and sunbathing remain banned. The British public will hold a minute's silence today to pay tribute to frontline workers who've died after contracting COVID-19. The government has announced it will make a £60,000 compensation payment, that's almost 70,000 euros, to families of health workers and social care staff who die fighting the outbreak. After years of underfunding and now a severe lack of personal protective equipment, the pandemic has laid bare the crisis within the UK's national health system.
And then put it on.
A long-sleeved gown that protects him from coronavirus. Dr. Asif Munaf almost feels guilty every time he puts one on. He's an emergency doctor, so he does have access to personal protective equipment, or PPE. But supplies across the UK are very limited. There simply aren't enough gowns for every doctor.
When I go to A&E, I get changed into PPE. I'm conscious of not using too much PPE. The cardboard box of supplies is getting less and less and less and less every time I go to A&E. But we have to wear it. We are in a high-risk environment.
3/4 of all UK doctors say they don't have access to protective clothing. Visors and masks are also in short supply.
Some doctors are having to buy their own FFP3 masks from DIY stores and from building merchants. And we're also having to do things like make their own aprons out of rubbish bin bags to try and protect their clothing whilst they're doing these high-risk procedures.
Over 100 medical staff, doctors as well as nurses, have already died from the virus. On social media, videos like this are being shared. Hospital workers paying their last respects to a colleague. Even before the crisis, the UK was short of over 40,000 nurses. Staff are now under enormous pressure.
Even very experienced nurses have been pushed to the edge, and we have a lot of newly qualified staff who've only been in the job 6 months or 1 year, and they've really been pushed to breaking point.
We are already underfunded. We need more doctors and nurses to work in the NHS, even in normal times. So at the moment, we are above and beyond what we ever thought that we could be in terms of working, and we're trying our best, but we do need more staff and we need more equipment, and that is a result of underfunding over the last decade.
And patients are suffering too. Hospitals are having to ration supplies like oxygen or dialysis fluid for patients with kidney failure. Dr. Munaf describes situations where older patients that might have benefited from intensive care have been denied treatment.
Whereas a few months ago, people over 65, we would have perhaps considered intubating and ventilating them, but now these criteria are so stringent, some trusts are very reluctant to intubate people above the age of 55. I have had a few patients which I deemed appropriate for intensive care units, but the ICU people rejected, and I think a lot of that has been, in a way, a form of rationing.
Britain's National Health Service is facing its biggest emergency since its founding.
And DW's Birgit Maas, who filed that report, joins us now from London. Birgit, the UK is a rich country that's been mobilising resources to deal with this pandemic for months, yet its health system is having real trouble coping. Why?
Well, when you look at it from the outside, the UK health system comes across as not being very resilient. It's not been designed to cope with a pandemic like this, you could almost say. Was almost before the pandemic running at full capacity. So this huge surge in patients, hospitals have just really had to struggle. You have almost any other elective surgery or even things like cancer care at the moment. Everything has been on hold. Everything has stopped just in order to deal with this crisis. And cancer charities, for example, are warning that thousands of cancers are going undetected because patients are reluctant to go to GPs, but also there are no referrals to specialists and no surgeries. So it will present a huge problem also further down the line when slowly all these normal services are being resumed. And yes, critics say that this is due to severe underfunding, particularly in the last decade, where the country has seen a lot of austerity as a result of the financial crisis.
Now, at noon, Britain is to hold a minute's silence to commemorate key workers who have died from COVID-19. Tell us more about that.
Well, yes, like in many other countries, key workers, particularly hospital staff, doctors, nurses, they're being seen as heroes across the UK. You see in many windows there are little rainbows that symbolize the NHS and symbolize the support that families and the gratitude that they have for NHS workers. Now, this is a minute of silence to, well, have the whole country come together and commemorate those people who have sacrificed their life while they were helping others to survive. We've also seen on the back of this the government announcing a new scheme, a compensation scheme. So for key NHS workers who have died or will be dying in the future, there will be a financial compensation. So this is also an official mark of the gratitude that the government is showing to everybody who's on the front line against the virus.
Well, speaking of the government, yesterday we saw Prime Minister Boris Johnson back in public, back at work for the first time since he contracted the coronavirus. How important is his return for the country's battle against the pandemic?
Well, there was a sense of a void at the helm of the government at this really key moment in the country's history, really, because, of course, there were only ministers giving daily updates, but there was a sense that maybe the really big decisions weren't being taken just because the Prime Minister wasn't there and wasn't there to basically lead the country. So we have seen now that Boris Johnson has come in, for example, this official support for the care workers that we have just talked about, but also what's being expected of him is really what comes next. How is he going to lead the country out of this crisis? We see many other countries across the world are slowly opening up the very strict lockdown. The UK is not one of those. People are really pressing the Prime Minister to be transparent and to talk about what strategy is the UK going to have and what's the thinking, what's the government thinking of the head of the government really behind when is the country opening up. And we can expect many more people pressing the Prime Minister just to be more open in the near future.
Birgit, thank you very much. That was DW's Birgit Maas in London. Let's get a roundup now of some of the latest developments in the pandemic. The number of confirmed COVID-19 cases worldwide has passed 3 million. That's according to the Johns Hopkins University database. New figures show that transmissions in Germany have ticked higher. The reproduction rate is now back at 1, meaning those infected with the virus pass it to one other person. Starting May 1st, Austria will allow gatherings of up to 10 people as the country eases restrictions. And Spain and France will also outline plans today on how to lift their 6-week lockdowns. This week saw Spain's children leave the confinement of their homes for the first time in 6 weeks. The decision followed heated public debate about Spain's very strict curfew. There had been growing calls to loosen the restrictions for youngsters, with experts warning of the psychological impact of keeping children indoors. DW's Jan-Philipp Scholz went to meet one family as they left lockdown.
Eba, Alba and Javi have waited for 43 days for this exact moment. They are finally allowed to leave their apartment again, accompanied by their mother, of course. They say it's a great feeling, but a little unusual too. You see a lot of kids, hardly any adults on the street. And there aren't any cars. The constraints imposed on children were some of the strictest in Europe. They were not allowed outside, not even for a few minutes. This gives them all the more reasons to be excited about what's finally possible again. My friend lives really close. Maybe I can at least see her from a distance. But only from a distance. And tomorrow we all go roller skating. You too. Today's destination, Grandma and Grandpa. But very strict rules apply while getting there. Cycling and running is allowed. Playing with other kids is not. Their grandparents' house is within the permitted 1 kilometer radius, but visiting them is not the same as it used to be. Grandpa is not allowed to hug or lift them up. This is something everybody has to get used to. Several days of confusion preceded the Spanish government's decision to allow children to go outside for walks again. The original plan was that they would only be allowed to accompany their parents to the supermarket. But eventually, the public pressure became too strong. More and more parents insisted that after 6 weeks without any fresh air, the limit for children had been reached. Many experts are glad about their government's change of heart, including psychiatrist Diego Figuera. He was one of the many who advocated to loosen the restrictions for children. But even if the measures are gradually reduced, new problems might arise. Children that have been spending most of their time with their parents might have a hard time adjusting to school or other groups outside their families again. This might cause serious phobias or even result in kids refusing to leave the house. Eva, Alba and Javi enjoy their time outside despite the new strange circumstances. The allotted 60 minutes pass away too quickly. The three of them are already making plans for tomorrow when they can spend their next hour outside. And maybe Alba will be able to see her girlfriend, even if it's only from a distance.
Well, for more on this, let's talk to Angharad Rudkin. She's a child clinical psychologist at the University of Southampton in England. Thanks for joining us. What are the main psychological challenges that children face in this pandemic?
I think there's many, actually. I think that the lack of social contact with people outside their family is a big one. But I think also the intensity of living inside that family unit, so squabbles with siblings, rattier parents, I think it can all help to create quite a bit of turmoil for children, especially younger children who find it difficult to understand what is going on. But for teenagers in particular, they're a real worry, actually, because they rely so heavily on social contact with peers every single day to help them feel good about themselves. So they've really missed out on that as well. So there's a lot of psychological impacts, really. But one thing that I have found is that the young people that I was working with before this all happened, and I was working with them around anxiety, they're enjoying a temporary relief from their anxieties because they're now living in a bubble. And the things that used to make them feel really anxious, such as going to school or seeing other people, has actually reduced. So for some people, it hasn't been all bad.
Okay, so social distancing is particularly tough for young people, but what about the general psychological environment, living in a situation where there's a killer virus on the loose and people are dying and there are thousands all around them? I mean, this must be a particular burden for them.
I think that threat is enormous, but from my experience, I think it's more the adults who've really processed that threat. Very young children, it's just too big for them to take on. They can't really understand the enormity of it, so we have to bring it down to the day-to-day, wash your hands, don't go near other people. For teenagers, I think they felt quite a bit of existential angst around it, but because it's not hitting teenagers as much as other age groups, I think they're feeling pretty protected from it, in fact. So the biggest threat is changes to families in terms of grandparents and elderly relatives and vulnerable relatives. Right. So a lot of young people are dealing with that threat okay, actually, and more what they're experiencing difficulties with is the day-to-day, not being able to see their friends, for example.
What advice would you give to parents as a child psychologist to help them support their children in coping with this crisis?
It's a really difficult time, and parents are going to be putting a lot of expectations on themselves. And actually, it's the toughest job in the world at the best of times. So right now is going to be very, very tough. So as a parent, just set yourself small goals. What is it that you would like to do to make sure that that day's gone okay? A couple of things that you want to get done. Go very easy on yourself as a parent. But in terms of your child, don't worry about them having to, be incredibly educated during this time. You just need to tread water with the learning. A lot of parents are very anxious about screen time and how much time their children, especially teenagers, are spending gaming during the day. And again, it's just about having to just take a step back as a parent and think, what is it that I need to do right now? I need to keep my child well and safe and healthy. And these just involve little steps. They don't need to involve any big changes.
Thank you so much. That was Angharad Rudkin. She's a child psychologist at the University of Southampton. Thanks for talking with us.
Thank you.
Well, the coronavirus lockdown has sometimes meant loneliness, especially for the elderly, who are among the most vulnerable in this pandemic. They're cut off from friends and relatives they haven't seen for months. But one enterprising Belgian businessman has come up with an idea that's taken some of the distance out of social distancing.
Clémentine has been waiting for this moment for almost 2 months. Her husband is in this Brussels care home. The last time she saw him was in early March. Now they're reunited for a few precious minutes.
This is great, isn't it? It's great.
I think I'll have to stay here.
The idea of using cranes to hold people closer together was a brainchild of Tristan van den Bosch. He's the manager of the company that rents out the platforms for window cleaning and fruit picking.
I saw somebody waving at his mother 2 or 3 floors up, and I thought, given that we have a serious fall in business, we can lift that man up to the window with our machines. And that's what we did.
84-year-old Clémentine says that the crane ride has given her at least a semblance of intimacy with her loved one.
I am very happy that I could speak to him that closely. It's great. I really appreciate this initiative.
Now Clémentine's back down on solid ground, and her husband's still in lockdown. Even so, just a few minutes with him have made a huge difference.